I grew up in St. Louis, Missouri, and obtained my undergraduate degree at Washington University in St. Louis, and then finished medical school in St. Louis as well at St. Louis University. Following that, I went to Vanderbilt University, where I was a resident in ophthalmology, and then did my vitreoretinal surgical training at the University of Iowa in Iowa City. In medical school, I was initially drawn to several surgical subspecialties. I developed an initial interest in ophthalmology and specifically vitreoretinal surgery related to my grandfather's struggles with vision loss from age-related macular degeneration. Once I was exposed to ophthalmology in medical school, I was astounded by the complexity of the eye, the intricate surgical procedures, and the ability to improve sight. During my residency training, I had quite a bit of exposure to vitreoretinal surgery and had great mentors that provided me with lots of exposure to surgery and led me down this path. Looking back, I couldn't be more satisfied with the career choices I've made. It's incredibly valuable. Many of our patients are facing the prospect of severe visual impairment. Being able to effectively communicate and provide patients with a real understanding of their condition, show them empathy, and engender confidence are critical in their treatment. As a vitreoretinal surgeon, I care for patients with a broad range of medical and surgical conditions that impact the retina. The most common conditions I treat include age-related macular degeneration, complications from diabetic retinopathy, retinal vascular occlusions, retinal detachments, macular holes, and several less common conditions. A macular hole is a condition where the central portion of the retina, the macula, develops a small discontinuity or hole. This results in a small area directly in the center of a patient's vision being absent. This condition is treated surgically with a procedure called a vitrectomy. In nearly all cases, we're able to successfully close the hole and have a resulting improvement in the patient's vision. Like many of our treatments, this has only been possible over the past several decades, and previously patients were subject to permanent irreversible vision loss. In the last 15 years, there have been great advancements in the treatment of both diabetic macular edema and age-related macular degeneration. Injectable medications have allowed patients to be stabilized, in the majority of cases, experience improved vision in situations where they previously would have experienced progressive permanent vision loss. At present, there are several medications in various stages of clinical trials that will hopefully be shown to further improve treatment outcomes and allow us to treat patients with fewer injections and achieve even better visual results. We're fortunate at Retina Specialty Institute to be involved in many of the current trials that will likely result in the next generation of medications that we use to treat our patients. Practicing at Retina Specialty Institute allows me to provide the highest possible quality of care. The equipment in each office and operating room is the most up-to-date and excellent available. The staff members at all locations are highly trained and facilitate excellent care. The practice as a whole is a very well-run organization with excellent administrative support. This allows physicians like me to focus completely on my patients without unnecessary distractions, so patient care can be second to none.